What's up, guys? Back again. And I know this time it's a little bit different. I don't normally do videos like this, but I'm experimenting to see how it goes. It is now 4:20 p.m. I'm here for another call shift. This is going to be about a 15 to 16 hour call. And I just figured, I'm here a little bit early. That's one thing that's key as well. Always make sure you get in early. You'll be shocked how much the attendings and the rest of your staff actually notice that. I like to go early because I like to just sit down, clear my mind, get into the zone. Being on call is a big deal. It's part of becoming a physician, and it's part of, I shouldn't even say becoming a physician, it's part of being a physician, because as a doctor, almost all doctors are on call. There's certain doctors that are not on call, of course. There's doctors that don't take call in their particular practices. Radiologists, interestingly, are not really on call often. The way that the model is starting to go towards now is that radiologists work shifts. So some doctors might be on the night shift, some doctors might be on the day shift. So technically there is no call. It's different though if you are an interventional radiologist, because then your schedule is almost like a surgeon or another physician who does surgical procedures. So you're going to be on call. You're going to be called when you're at home. You're going to have to come in the middle of the night, and you're going to have to take care of your business. But that's the whole reason why you'd become an interventional radiologist, is to have that type of lifestyle. So, it's tough. Sometimes people ask, like, is it safe for a doctor to be on call for 24 hours, 16 hours? Usually other professions don't work in that type of way. They don't really work those type of hours, but for some reason for physicians it's different. And it's mixed. There's mixed literature out there, but there is studies that show that the majority of mistakes that happen when it comes to patient care actually happen during the transition zone, when one physician talks to another physician and kind of signs out, is how we call it, signs out the patient. And that's when usually a lot of the mistakes happen, interestingly. So if you have one physician there that is covering the whole time, turns out it's actually somewhat better. It actually limits those mistakes, which happen to be the highest percentage of mistakes that happen in the hospital and when it happens for patient care. So, but then again, then physicians are tired. Burnout is real. Burnout is a big problem. I have another video on burnout and how to prevent burnout. But in medicine, burnout is real. It's a real thing. I can't deny it. That's just the way it goes. But I feel like, a part of it is, our profession is different than other professions. It's not to put down any other profession. Everybody works hard. It's not about working hard. Our profession deals with issues that are literally life and death. And that's it. And I don't want to sugarcoat it. I'm not trying to say physicians are better, but the stuff we deal with has bigger implications. So because of that, it's just the way it goes. You have to go through this type of grueling period, and you just have to kind of go through it, because at the end of the day, it just makes you better. Like today, for example, I'm not touting about myself, but I'm on call today for 16 hours. Some call days, I just relax and I don't do anything until, I go to the hospital to begin and take my call. Today, I decided to sit and study. I studied for like 4 hours. I wanted to study for about 2, but then, you get into it. I have another video about that. When you get into the zone and when you reach that steady state of studying, you don't want to stop. The whole point is, the whole difficulty is getting to that level. Once you get to that level, you have to continue, and you don't stop. So I then studied for about 4 hours before my call even started. Am I going to regret that? Maybe. It might be really busy, and I'm going to regret that I didn't turn my mind off and be mentally relaxed. But in the long run, it's going to help me for my boards. It's going to help me because I might see some of the things that I studied. I might see them tonight, and it'll just decrease stress in that moment. If I'm more familiar with it, if you're more familiar with the treatments, if you're more familiar with what disease pathologies look like, it'll just make it easier for you. Because then otherwise, I don't know, I can't speak for everybody, but otherwise you feel stressed. You don't know what's going to come into the emergency room, and you're the only doctor there covering your particular specialty for the night. And if you don't know what to do, nobody else knows what to do, so it's on you. So I'd rather be a little bit tired and feel like, I should have relaxed, but I'd rather be prepared just in case anything comes. And I was like that when I was in internal medicine as well. So it's just the same principles I kind of carried over. I'd rather be a little bit over prepared, because in the long run, your stress level drops. So the rest of your evenings become easier. So when you see something, you don't freak out internally, I should say. You don't freak out internally, because all physicians are freaking out internally and they just can't express it externally. That's a sign of a good physician. Never express how freaked out you are externally. Doesn't matter what you see. I'll give you a quick story, quick example. I remember I was on the trauma team and somebody had come in who was in a motor vehicle collision, and they basically came in just about auto amputated. So the leg was completely, almost auto amputated by a car that ran this guy over, poor guy. And me being there, I had to assess the pulses to make sure that he's got pulses down the legs. If he doesn't, he needs to go to the operating room right away. Vascular surgery needs to go right away. And I've never seen anything like that before. I've never seen an extremity mangled. Basically, he came in and the EMTs gave him to me and basically told me that, his lower extremity is pretty much auto amputated. And I looked, and his extremity, his leg was wrapped around, twisted, and it was literally, his foot was resting on his thigh. It was basically on his thigh. And I had to untwist his lower extremity and check for pulses, and then make the decision of do we keep him here? Is he okay? Or do we take him straight to the operating room? I untwisted his, and I had to pretend like this was normal. EMT gave this guy to me, and I'm just internally, I'm whoa, I've never seen anything like this before. But you're the doctor there. So I had untwisted his leg, felt for pulses, and within minutes, I was wheeling him to the operating room. And, nobody knew any better. Internally, yeah, I was freaking out. But now, because I saw that and because I went through that experience, now if that ever happens again, now when I'm confident on the outside, it'll be true confidence, not just faking it. No, doctors don't fake it. It's just, it's different. Sometimes, it's not possible for you to see everything, especially when you're so young in your career. Maybe when you have years and years of experience under your belt, it's possible. But early on, it's not. But that's not an excuse. You can't be I'm not familiar. I've never dealt with a situation like this. But don't mistake that for being afraid to ask for help. And it doesn't matter who you ask. It could be your other colleagues, other physicians, or ancillary staff, such as, mid-level providers, nurses. When you need the help, you have to be secure in yourself to just ask for it. And you have no idea how much that comes through in the clutch when nurses and other staff help you out when you have no idea what's going on. So shout out to all the nurses, nurse practitioners, PAs, mid-level providers, technicians. You guys have kind of helped me get me to where I'm at now, and I'm continuously grateful to you guys, and I continue to utilize the skills that you have. Everybody has a skill set. Doesn't just because you're the macho MD doesn't mean anything. Everybody has a skill set, and you should utilize everything that you have for your skill set to make yourself better. And because at the end of the day, it's not really about you, it's about the patient. If you're better, it's better for your patient. So yeah, I'm just rambling on and on. That's basically all I have to say at this time. Just drinking the coffee, and I'm gonna be going in very, very soon. So just another call day. Probably won't be filming tonight on call, but if anything comes up interesting, I'll touch base with you guys. But if I don't, until next time, stay safe, and I'll see you next time.